Dear friends, dear colleagues, my name is Christopher Cook. I'm an interventional cardiologist in London, and I'm delighted to be joined by Iqbal Malik, who is Director of Structural Intervention at Imperial College NHS Trust, London. The topic of this Facing COVID-19 with PCR video is to provide guidance about protection during the coronavirus pandemic. Now, although we as interventional cardiologists are well accustomed to standard sterile operating procedures and indeed protection from radiation, there is a significant increase in knowledge and practice that we need to attain in order to protect against the viral transmission of COVID-19 and ultimately to break the chain of infection. Iqbal, you've been very active educating on this topic on social media. Can you share with us your approach to the topic of protection in the coronavirus pandemic?
Thank you, Chris. It is a terrible time, and I think it's an opportunity to learn from others in the first instance, as we are not the first to be affected, and then use the time that we have to practice and to simulate so that we do not do anything for the first time when we first have to treat a COVID patient. And so once we've learnt that ourselves, then our duty would be to also then train others who have not yet been exposed. So part of the content here is the videoing that we've done to allow remote learning whilst we are in social isolation.
And what has your approach to protection been?
I've tried to structure it so that we have 5 components: the patient, the professional, the team, the hospital, and of course your own home.
Okay, so your approach is multifactorial. So let's go into this in more detail now. In protecting first the patient, what do you think is really important?
I think there are 3 big topics here. The first is they need to be protected from us. We may be the carrier that gives it to them, and by default our patients are vulnerable. Then they need to be protected from our environment, the hospital, and so we want to try and minimize their exposure. And then if they do need to come to us, we need to be treating them safely and effectively.
Okay, so we need to think of ways to try and minimize the hospital stay of patients during the pandemic. Can you give us an example of this from your own clinical practice?
Sure. The biggest thing we've done is cancelled all electives, and we have a resource where one of our chief surgeons is speaking about not operating anymore. There's been a switch to less invasive treatments with less time spent in hospital. So instead of open heart surgery, you have a TAVI. Instead of surgery, you have angioplasty, minimizing the stay in hospital.
Now, one concern may be that if our message of staying at home is too strong, then patients who are having acute coronary syndromes may not have the confidence to call for the ambulance in time. How can we ensure these patients still receive the best possible care?
That's a really good point, because I think our message has been so strong that we've all noticed a sudden drop in our acute coronary syndromes. And so we need to actually reverse that. And in the UK, at least, there's a very strong message from the British Heart Foundation about saying, if you actually are thinking you have a heart attack or stroke, please call. Please call and come to the hospital. We're still open for business. And we have some resources linked to that to explain how we've done that.
Great. So protection of our patients is, of course, our primary concern, but we do also have to ensure that we are protected as well. Can you expand on the topic of protection for the healthcare professional, and what do you think is really important?
First of all, I think we have to be protected from the patient, so we should mask the patient. Secondly, we should be wearing appropriate personal protective equipment and be fit tested. And thirdly, it is not just about the cardiac catheter lab. There are professionals in our organization working outside who need just as much protection.
Okay, so you mentioned masking all patients during their procedures in the lab. Have you encountered any challenges in this approach?
Most patients will accept it, so I don't think they're reluctant to wear it. If they require oxygen, then the oxygen mask you have per se will reduce any spit or aerosol that's generated. But if you still want to put the surgical mask on the patient, then nasal prongs work absolutely fine.
Now, some might question why all coronary angioplasty procedures are considered aerosol generating that require full PPE. What is your comment on this?
I think if we're dealing with any cardiac procedure, then if you've done enough, you've seen the complications and a cardiac arrest scenario may arise. Not only are you very close to the patient, not only is even speaking now thought to be aerosol generating, but actually if they have a cardiac arrest, then they will definitely generate aerosol. There's no debate about that. So if that is going to happen and the patient may have COVID, then if you are not fully protected, then you will be infected. And hence the reason in this current climate to have full PPE for the team.
I fully agree. And with global difficulties in obtaining and replenishing PPE stocks, do you have any tips on how to innovate with existing PPE to maximize protection?
There are quite a few resources we've now developed. So I taped my own mask to my face when I failed my fit test. We've got some of our workers using scuba diving masks, and the building industry has a set of very good masks that we have repurposed for our team. So there's lots of tips and tricks available.
Great. So you mentioned team there, and of course, we always work in teams. So how can we ensure the protection of the wider healthcare team?
Again, I think it's a multifactorial thing. So step one is to get the warning that a COVID positive patient is coming. And we have a resource now that tells us how the ambulance service can give us that warning so the team can be fully prepared. Once you have the team, then as you know, with cases, the team can change. The anaesthetist may come in. There may be a change of personnel. We need to be sure that each member of that team is not only protected from radiation in the lab, but also now fully covered by PPE to protect them from coronavirus. And finally, there is the issue that there is no I in team, as they say, but there has to be a leader. And the leader of the team needs to be approachable and build resilience in that team.
So you mentioned leadership there. Now, have you got any specific examples of leadership that you think are important for the protection of the healthcare team?
So I think when you're acting as the leader, part of it is to produce the safety for the rest of the team. So I'm quite belligerent, I'm quite aggressive when people are coming into the lab to make sure they're protected. A recent example is that my own fellow, for some reason, did not have the full PPE on and therefore had to be sent out to do it again. But on top of that, I think you have to show yourself to be approachable and present. There's no point in being an absent leader. And that approachability builds a resilience in the team. If they can talk to you, if they can share their concerns with you, then the team will work better.
Now, of course, that approach requires the ability to communicate easily and effectively, but what challenges are there when wearing PPE?
So if anyone's ever worn the full PPE setup, then you realize that your voice, which may have been loud or not, does not carry very well. So using specific names to give tasks and also to have a video setup. We've got a resource available which shows you how to set up a video conference between the inside and the outside of the lab. Because whereas before you could easily call for that next stent and someone runs in to get it for you, that is not going to happen now. They will need full coverage. So giving them some warning with a video conference between inside and outside adds a great deal to the party.
Okay, so we've talked about protecting the patient, the professional, and now the wider team. But the pandemic has forced us to completely reorganize our whole hospitals. What has been the approach to protecting the hospital?
So I think the first step is to plan early. And we've got a great resource here where we've checked out how to create red and green zones in the hospital so that the patients can be managed in a COVID positive or COVID negative environment. every hospital will need to consider how to expand their intensive care capacity, because unfortunately it will get full. And finally, there is the idea of regional or network working, because each hospital is certainly not in isolation. There are others in the region that can work together.
Now, were these major changes to the hospital led by clinicians or managers?
So this has been a teamwork, but I think if you have no clinician leading it, then the imperative, which is to help the patients, may be somewhat lost, because the senior clinicians usually have a wealth of experience for a decade or more, which some of the senior managers may not share. But it's definitely working as a team, and we are blessed at Imperial to have a very solid team working between the clinicians and the management team.
So lastly, Iqbal, and I think importantly for our viewers, how can we ensure that we protect our loved ones at home when we return back from the hospital?
So step one, don't leave the house in the first place. I think with all the electronics available, for 2 days of the working week, I am able to do everything I need to at home using information technology. The second step is, if you haven't protected yourself at work, then you haven't protected your family when you get home. So protect yourself. And finally, when you do get home, then imagine you are covered in a blue powdery pigment. If you have that in your head, then you will know that you have to take your shoes off at the door, to change your clothes, to shower carefully, and then get into contact with your family.
Thank you, Iqbal, for that in-depth summary of your approach to protection during the COVID-19 pandemic. And just to summarize the key take-home messages for our colleagues. And this is firstly to be prepared, to train, to simulate your approach, to practice, and then ultimately to teach others. Because the key message is you do not want to be trying these approaches to protection for the first time for real. Secondly, it is that protection is a multifactorial problem. And we've discussed protecting the patient, the professional, the wider healthcare team, the hospital, and importantly also the home. So Iqbal, on behalf of our colleagues, I want to thank you for your personal efforts and that of your team in developing so many learning resources dedicated to the topic of protection during the pandemic. And lastly, for our general viewers, for further learning resources, you can refer to the other specific videos which form part of the Facing COVID-19 with PCR series.